Hello, everyone. I record this on the behalf of Bright Kelvin Urasa from Tanzania, representing the Affirmative Team, debating the question: should genetic testing for inherited heart conditions be part of routine healthcare in African countries? Our answer is a clear and confident yes. Every year across Africa, many people, especially young people, lose their lives to inherited heart conditions that were never diagnosed. These are not unavoidable tragedies. In many cases, they are preventable deaths. Conditions such as hypertrophic cardiomyopathy, long QT syndrome, Brugada syndrome, and familial hypercholesterolemia can remain silent for years before causing serious illness or sudden cardiac death. Genetic testing gives us the opportunity to identify individuals at risk before symptoms become life-threatening. The affirmative position rests on three pillars. First, detection saves lives. Second, Africa carries an invisible burden. Third, it's affordable and equitable. The first reason we support routine genetic testing is simple: early detection saves lives. When inherited heart conditions are identified early, healthcare providers can monitor patients, recommend lifestyle modifications, prescribe appropriate medications, and implement preventive measures. Studies have shown that early diagnosis and proper management can dramatically reduce the risk of sudden cardiac death. Second, Africa faces a major challenge of underdiagnosis. Many individuals living with inherited cardiac conditions do not know they are at risk. In numerous African countries, access to genetic testing remains limited, meaning that many diagnoses are missed until a medical emergency occurs. Integrating genetic testing into routine healthcare would help move diagnosis from crisis management to prevention. Third, routine genetic testing can be cost-effective. While genetic testing requires an initial investment, the costs associated with emergency hospitalizations, advanced heart disease, repeated admissions, and premature deaths are often much higher. Prevention is not only better medicine, it is also better economics. Fourth, inherited heart conditions affect families, not just individuals. When one person is diagnosed, relatives can also be screened through cascade testing. This allows healthcare systems to identify additional at-risk family members and intervene early. One diagnosis can lead to the protection of an entire family network. Fifth, integrating genetic testing into healthcare helps build African genomic capacity. African populations remain underrepresented in global genomic databases. Expanding access to testing will generate valuable African data, strengthen local research capacity, and contribute to more accurate and equitable healthcare solutions for African populations. Finally, genetic testing improves diagnostic accuracy and supports precision medicine. Many inherited cardiac conditions can be mistaken for other diseases. Genetic information helps clinicians make more accurate diagnoses, avoid inappropriate treatments, and select the most effective interventions for each patient. In conclusion, routine genetic testing for inherited heart conditions should be part of healthcare systems across Africa because it saves lives, supports prevention, strengthens families, improves diagnostic accuracy, builds scientific capacity, and promotes equitable access to precision medicine. The science exists, the need is real, and the opportunity to improve health outcomes for millions of Africans is within our reach. Thank you.